Okay, coaches, have you ever been in a situation with a client when you have felt like you might be getting out of your lane as a health and wellness coach, or maybe you didn't even realize there were lanes to follow as a coach? Oh yes, this is a big deal in our profession. And if we miss the mark on this one, we not only risk our own professional credibility, we also fall short on our ability to fully serve our clients. In the next few minutes, I'll highlight some of the key aspects tied to both why and when we need to refer out. I'm Susan McGarry, a national board certified health and wellness coach with Catalyst Coaching Institute, where we provide coaches and others with tools and resources to be a catalyst. But coaching is no longer the Wild West. We are an established profession, and with that, credibility comes great responsibility. Now let's jump in. Let's say you're driving along or on the coaching along with the motivational interviewing and behavior change dance, and you start veering into the lane next to you. Maybe you're giving advice on an expert topic or noticing the big emotional and psychological changes your client is facing and trying to coach them through it. Fortunately, you recognize the lane change. You know you shouldn't be there. It's out of our scope of practice, and so you get back in your lane. But how can we know exactly when and where to refer our clients to someone who specializes in a different area? According to the National Board of Health and Wellness Coaching, health and wellness coaches work with individuals and groups in a client-centered process to facilitate and empower the client to develop and achieve self-determined goals related to health and wellness. Coaches support clients in mobilizing their strengths and internal and external resources and making sustainable, healthy lifestyle changes. Now that's a mouthful, so let's dig into what it means. In a nutshell, it's our job to help our clients explore their own motivation to make whatever change it is that they want to make. Coaches can be the catalyst in helping the client reflect on their strengths and resources and how to make a change that works for that specific person in their world. The opportunity to help the clients make the change that their doctor, PT, dietitian, or other professional is in our scope of practice. We focus on the why, how, and what the client will do to carry out those recommendations. We help them to take the technical and make it practical. But what exactly is our scope of practice as a wellness coach? The NBHWC determines wellness coaches' scope of practice as follows. While health and wellness coaches per se do not diagnose conditions, prescribe treatments, or provide psychological therapeutic interventions, they may provide expert guidance in areas in which they hold active nationally recognized credentials. We support our clients in achieving health goals and behavior change based on the client's own goals and consistent with prescribed treatment plans. It then notes how we tap into the client's path that moves toward healthy lifestyle change. As we know, our profession has not yet been regulated in specific states. However, experts like psychologists, counselors, dietitians, nurses, physical therapists, OTs, and doctors have a regulatory body that does determine what is in their scope of practice by law. If you feel like you may be crossing into another's professional lane, you may want to check that specific provider's regulations in your state to make sure that you're not veering over. Next up, when do we refer? We do not prescribe, diagnose, or recommend. Our job is to be supportive in what the client chooses to do to improve their wellness. Let's talk quickly through 3 scenarios we might encounter as a coach to help bring this to light. Client A shares that they want to improve their nutrition. They've been struggling with their weight, and their doctor has recommended that they lose 10 to 20 pounds. The client is borderline diabetic and has high blood pressure. They ask you, can you give me a nutrition plan so that I can lose 1 pound per week? To stay within our scope of practice, we would ask, what have they tried in the past? What has the doctor recommended? And what the client has thought about doing on their own? However, we are not registered dietitians or nutritionists. Therefore, we cannot prescribe a specific nutrition plan. In addition, this client has high blood pressure and is borderline diabetic. Therefore, there may be a specific nutrition plan that is best if, after exploring with the client what they know about nutrition, they continue to want a plan. We would refer them to an expert in this area. Example 2. This is your third wellness coaching session with client B. They have been struggling with feeling sad, a lack of energy, a change in appetite, interrupted sleep, and frustrations with relationships. You have discussed these topics in your sessions with the client, setting goals to improve lifestyle habits related to nutrition, sleep, communication, and self-care. The client continues to struggle with emotions and wants to process those emotions throughout your discussion. At this point, a referral to a counselor would be appropriate. You may want to say something like, "I'm curious, have you ever tried talking to a counselor about these feelings?" One more example. Client C shares that they had shoulder surgery a year ago and they have been experiencing a lack of range of motion, and it has been affecting their daily functioning at work and at home. And they went to physical therapy for 3 months after surgery. The client has tried doing the exercises prescribed at that time just recently. However, it is not improving their range of motion. After exploring what they have been doing to improve their functioning, the importance of having their range of motion, and their motivation for doing so, the client is still uncertain of what are the next action steps. This is an opportunity as the coach to refer this client back to the physical therapist or physician, something they may have been hesitant to do without your encouragement as their coach. As highly trained health and wellness coaches, we have the unique opportunity to encourage and support our clients through exploring their motivation for change and how to make that change. However, as we do so, it's critical we continue to ask ourselves, is the client needing us to prescribe, diagnose, or recommend? And in doing so, could the client be harmed? If we answer yes to either question, it's time to refer. There are more tools and resources to enhance your coaching career and business at catalystcoachinginstitute.com. Or if you have a few more minutes to stick around, you might find this video here to be beneficial.